Well, I think it helps them be able to realize that I come from a similar situation to them, that I know kind of what they're going through, kind of their sacrifices that they make to get here, as well as just kind of them knowing that, kind of the personal aspect that I'm a person too, and that they can open up to me and feel like, that they can get good care from me. I know yesterday I even had a patient that was ranch lady from Beach who, we were able to kind of talk to her about why some of her problems may be related to her lifting 100-pound feed bags when she's almost 80 years old.
Reimagining Rural Health, a podcast series by Sanford Health. Our host is Alan Helgeson with Sanford Health News.
Dickinson, North Dakota. It's right along I-94 in western North Dakota. When you're in town, a stop at local eatery Blue 42 might be for you if you want a bacon flight. Or how about knocking down some pins and a little bowling talk like the recent Dick Mueller Memorial Tournament? Well, you can find that at Paragon Bowl. And it's pretty cool that dinosaurs still roam the area too. That's at the Badlands Dinosaur Museum, where they've got 14 full-scale dinosaurs on display. Dickinson is a community of almost 25,000, and they've got a lot going on. And when they need medical care, at Sanford Health, patients have access to care for many areas of health, including family medicine, orthopedics, cancer care, plastic surgery, and women's services. Now, if it's women's services and you're a patient, there's a good chance you'll hear her voice right after that knock on the exam room door.
I'm Dr. Elizabeth Brown, and I'm a OB-GYN at Sanford Health in Dickinson.
Dr. Brown is one of only 3 OB-GYN physicians at Sanford Dickinson. More about that, though, in a little bit. First, let's hear a different story, and one that begins about 100 miles west of Dickinson and not far from the Yellowstone River.
I'm Elizabeth Brown, and I live on a farm in Glendive, Montana.
To Elizabeth Brown, her husband Todd, and 3 kids, home is 650 acres. A working hay farm with roaring John Deere tractors, miniature donkeys, and Highland cows. Wait a minute, Highland cows? On the farm, having to know and do lots of things is important. Elizabeth Brown's husband, Todd, knows it means a lot, not only in the wide open spaces, but also when she's with her patients.
She's down to earth. I mean, she gets out here, she'll drive a cement truck, she'll drive skid steer, we work cows. If you wanted us to put a cow in the chute, and she could give it a shot.
I apologize in advance, it's kind of bumpy.
Elizabeth Brown's busy home life means trading in her stethoscope for a pair of pliers and some leather gloves. She climbs into the cab of something that might be a transformer. But this one is hiding out on her ranch, and today it's picking up bales of hay.
I think I have a lot of work cut out for me this weekend. So.
Why is that?
Oh, because my husband he made quite a few hay bales off of this field this year, and very good yield.
Okay, before we go any further, remember when you were in school and you would call your teacher Mr., Mrs., or Miss? Then you grew up and you met them in the store. You still call them Mr. or whatever? Well, for the rest of this podcast, to avoid any confusion, let's stick with Dr. Elizabeth Brown, in the clinic or on the farm. Sound good? Great. Now, where were we? Oh, yes. Well, when you live in eastern Montana, and your clinic and your patients are in western North Dakota, days can start pretty early.
So usually I leave around 5:30, sometimes 6. It depends on what time I need to be there. So if I'm on call, I need to leave for sure by 5:30 so that I get there by 7. I think it's about 92 miles, but with the interstate, I usually get there about hour 20 to hour 30 minutes, depending on what the construction is.
It's not really a big deal for Dr. Brown. She knows that her patients are doing it every day too, and they're coming from a good distance to see her.
So it's really probably like eastern Montana and western North Dakota. So we have some people, from south, have some people from like Hedinger. I think we've had some people from Bowman coming up. eastern Montana. I had some from Baker, some from Glendive, where I'm from as well, and then north, like Watford City. I would say, the longest would probably be like an hour and a half, maybe 2 hours that they would have to drive to get to us. And that would just be, probably like if they came from Baker, that's probably the longer drive.
With all of the time behind the wheel each week for Dr. Brown, she sees all of the weather extremes in rural North Dakota and Montana. And it's a topic that is never far away, at home.
So I actually, I watch the weather quite a lot. And to be honest, if I feel like there's going to be a storm coming in or the weather's going to be really bad or it's icy or anything like that, I try to either go up the night before
or in the clinic. My
patients and I oftentimes bond about the weather. It seems like ranchers and farmers, their lives revolve kind of around kind of what the weather is. And, when you say all they do at the coffee shop is kind of talk about the weather and, what's going on. But it really determines a lot of what we do. And so for me, I talked about earlier about how I look at the weather reports and make sure, like with driving, and I'm understanding to a lot of the patients when they're like, 15, 20 minutes late. And I'm like, well, yeah, the roads were horrible. So let's go ahead and, just see them because I know how far they've come from and we want to make sure that they don't have to come back.
After her morning drive to Dickinson, it's game on and a full day with patients.
A typical day actually starts with me usually rounding on patients in the hospital, if I've done any deliveries or any post-operative patients, and then I come over to the clinic and start seeing patients around 8 a.m. Before 8 a.m., if I get over here to the clinic, I'll go through the chart, see if there's any results to review, see if there's any patient messages, nurse messages, other staff messages from other physicians.
When providing care in a rural community, it means that medical professionals like Dr. Brown are relied upon for their depth of expertise.
Actually, it's very rewarding to see a lot of different things. We kind of take care of women from menarche all the way to postmenopausal. So a typical day will include, some OB patients, some new OBs, some routine OBs. It may include people with bleeding issues, contraception management. We manage abnormal pap smears, so sometimes I'll have, a colposcopy or a LEEP procedure, and so that's kind of the typical day is just a variety of things, and so you never know what you're going to get on any given day.
For Dr. Brown, with a busy professional life and home life, there have to be similarities in there somewhere, right?
I guess one of them is just that you're almost, you're going. So, at the farm, there's not much downtime. Here in the clinic, there's not much downtime. You also, preparing for your day, just like at the farm, if we need to do, grease your equipment, you need to make sure you're fueled up, make sure that, the windshield is clean, or, kind of come up with that plan of the day. The same thing over here in the clinic. Make sure the rooms are stocked. For me, for appointments, it's making sure that I know exactly what the nurses are going to be, what they need, what I need in the rooms, kind of prepping my nurse before we go into those appointments.
Having this perspective and seeing these similarities makes a difference with the people she sees every day, not only in the clinic exam rooms or in the hospital rooms, but likely on the sidewalk, the grocery store, or in the stands at the high school game this week.
I think in the rural communities, you kind of, the patients know you and you know your family, and so you kind of have that connection outside of the medicine physician-patient relationship. You also they may know you outside of the clinic, and so you kind of have that special bond with them as well in the rural setting. When people come from longer distances, I want to make sure that they feel like they get as much out of that visit as possible, as well as trying to coordinate their care before they leave. So if we can, they need an ultrasound, trying to get that ultrasound before they leave, trying to get the lab work done that day, knowing that they're not going to be able to come back, in 2 to 3 days very easily.
It's knowing how these miles can impact your patients' lives in rural communities and how it can make such a difference. When driving so many miles each day herself, it puts things in perspective for the patients that travel great distances to see her.
I know yesterday I even had a patient that was ranch lady from Beach who, we were able to kind of talk to her about why some of her problems may be related to her lifting 100-pound feed bags when she's almost 80 years old.
Thank you for calling Sanford. This is Teresa.
In the Sanford Dickinson Clinic, Dr. Brown is ready for a full day, and there is a lot to do.
We do a lot of messaging, like the MyChart, kind of doing that in the computer. Not everyone is okay with that. And so usually when patients leave, I'll ask them, are you signed up for the portal? Are you comfortable with getting messages that way? Or would you prefer to be called? Abnormal results or results that I feel like there needs to be a management based on it, I'll directly call, or I'll have my nurse call. So there's abnormal pap smear and we need to set up different things. I usually have prepped the patient in their visit. And so when my nurse calls, she's able to just kind of explain the procedure, get the patient forwarded to our scheduler, and that they're kind of aware. If they have additional questions, she'll send me a message and then I can reach out to them as well.
Sanford Health is the largest rural healthcare system in the U.S., and technology is key in helping connect expertise to patients in rural areas. Being able to see patients via technology is a plus.
And we definitely offer virtual visits. It seems like a lot of people like that face-to-face if they can, but we do, offer that ability. And then also if the patients, if they have one or two questions, we'll answer those. But if not, and we feel like we need to dedicate more time to them, we can convert, a telephone call over to a virtual visit just so that they have that time that's dedicated to them. Sometimes in these rural settings, especially when they know I'm a Montana person, they may also know some of my friends, some of my relatives, knowing, that they definitely do their research before they come in. And if they have any common people that they know, a lot of them will actually know who I am and kind of be aware of me before I come in. And they've had other people who've either friends or family who have recommended coming to see because they know, with me giving care, and they know that I'm a pretty down-to-earth person.
When working in a community the size of Dickinson, knowing and seeing your patients is important. But when you're doing things like spending 90 minutes on the road to get to work or loading a flatbed full of hay, personal life balance is always a good thing.
In Dickinson, we try to deliver all of our own patients that are established patients. That being said, we also realize that we need to have, our personal lives as well. So our weekends are Friday, Saturday, Sundays, and oftentimes it's whoever's on call will manage those deliveries. But if we're here in town, we're going to be doing our own deliveries.
As we've heard from Dr. Brown, it's easy to get a sense that she's definitely in the right place and with the people that need her most. But how does someone choose where they practice medicine? Does the community seem to call them? Deciding to be a physician isn't a choice that comes easily. In certain parts of the country, access to medical schooling can be limited, as was the case for Dr. Brown.
There's a certain number from Wyoming that every year we would get selected, and then we would do some of our training at our home state, and then we would go out to Seattle and did like an underserved pathway when I was there, and then also did a lot of rotations in rural, like Wyoming, in Washington, and then also in Montana. And I grew up in, my town was like 3,200 people, and as far as like Dickinson, with its size, it's a lot larger than what I grew up with, but it's still, as far as Ob-Gyn world, it's still a rural setting and providing care for a lot of women in the rural area around Dickinson.
For Dr. Elizabeth Brown, while she's seen patients today, it did take a little while to find the place where she belonged. Sanford Health.
Kind of the support that Sanford gives to physicians and kind of supportive of the practice, as well as the doctors that I work with at Sanford, the Ob-Gyn doctors, are very in line with how I practice. And so kind of all of those things, and kind of for like my mental health and ability, I feel like I'm actually a better mom, even though I'm working more and might be gone more. I probably wasn't the best mom when I was here, because it was not, when you're not in a job that you enjoy working at, you tend to be a little more short, not probably your best person that you could be.
When you provide medical care in a clinic that serves a diverse patient population in a rural community, you're afforded great opportunities, and it takes a certain openness and flexibility in doing things. So what kind of person thrives in this environment?
The kind of provider that enjoys a challenge, the kind of provider that is comfortable with not necessarily knowing what's going to walk through their door on any given day or time.
Now that sounds a lot like what Dr. Brown has been describing in her day-to-day clinic. But how do you replicate that passion for care and carry those special virtues into other communities when you have hospitals and clinics across a 300,000 square mile area? Who does that?
My name is Dr. Joshua Crabtree, and I am Sanford Health's chief physician.
Dr. Crabtree, in his role, leads a team of nearly 3,000 physicians and advanced practice providers across Sanford Health's footprint. And like Dr. Brown, Dr. Crabtree experienced rural health as a physician because he was a family medicine physician at Sanford Health in a rural community for over 2 decades. With that experience, Dr. Crabtree knows firsthand what else you need to be successful in rural health care.
One who's comfortable with a more general or broad scope of practice. One who likes to develop a little more of a broad or robust relationship with their patients. Their patients are not just going to be their patients in the exam room. They are going to also be their patients and connections that they have in communities, in the church, in the grocery store, probably at a sporting event or a choir concert. They're going to see and engage with their patients on multiple levels. The provider that will thrive in that environment is one who's comfortable and actually enjoys that. You have to be comfortable with maybe not knowing all the specific answers right now, but you know how to find those answers. You know where your resources are. You know that you have specialty colleagues, maybe subspecialty colleagues that are either a phone call away or a virtual visit away or an in-basket message through our electronic medical record away to help find those answers, to help provide those patients that come to us in all areas of our footprint with that top-notch world-class care that they should come to expect from Sanford.
Dr. Crabtree talked about the many different people involved in providing care at Sanford Health. And those various ways he talked about in staying connected.
We have made it our mission. In fact, it's the statement that we put out there that we are going to provide world-class care no matter your geography, no matter your zip code. As an organization, we are committed to making sure that whether it's through our virtual care platform or through outreaching to these communities, we send physicians or clinicians to over 430 different locations throughout our footprint on any given year to make sure that we're putting specialty care and high-quality generalist care in the communities where our patients are from. That's our commitment.
That world-class care? Well, Dr. Crabtree really looks to make sure this also means how Sanford takes care of their team, too. Dr. Brown is fairly new to Sanford and knows firsthand that new employee feeling.
So Sanford Health, there's the professional support. So as far as, they make sure I have nursing staff available. They make sure that we're working to get patients on my schedule, working with the call schedule, coordinating things to make, my life as stress-free as possible here. And so Sanford Health, with their physician support structure has been very helpful for that. Also, Dr. Oksa is our clinical director. She's constantly checking in on me, making sure that things are still going well and how to, how things can improve. And I even know when I was interviewed or even initially hired, even the higher ups, in Bismarck, were checking to be like, okay, is there anything else? How can we modify your practice so that we can keep you? They know how hard it is to recruit to this area, and so they definitely make sure that things are going that way. I think prior practice, this kind of the frustrations I have not ran into that. If I'm having an issue, people quickly address it, but also I feel like Sanford Health seems like a well-oiled machine that I'm able to, seamlessly kind of integrated myself into the clinic, and really, to me, it seems like it's been a very smooth startup and been able to establish pretty quickly.
A transition that allows Dr. Brown and her colleagues to care for patients in the way that is important to them and the people that trust them for that care.
And just know that they know that I'm not just someone who's, some city slicker who's doesn't even have any idea what's going on. So I know my husband reminded me of a time when I had to explain to one of his friend's wives that she could no longer throw in the net wrap because the net wrap is very heavy. And they're usually having to put it on odd angles. And I'm like, you can't do that after a hysterectomy. Like, your husband's going to have to come to the field. And so just trying to relate to them of like, okay. And most of the time, when they're coming here, like I said, that respect that the, North Dakotans or the Montanas have for physicians is very great.
Rural health care? Dr. Brown drives it, lives it, provides it every week to dozens of patients in and around Dickinson, North Dakota. She's fairly new to Sanford Health and talks about why she does what she does. But let's hear it from someone that has been in Dickinson and at Sanford Health for longer.
My name is Dr. Erica Hoffman. I'm an Ob-Gyn out in Dickinson, Sanford, and I actually grew up in Dickinson.
Dr. Hoffman knows the Dickinson community well, and as a physician with Sanford Dickinson, understands that living in a rural community gives an awareness of important things that mean so much for the patients they see every day.
It makes you a lot more aware of how much time patients put into their appointments and how much time and effort they make to come here, so you really want to do a great job caring for these people, being cognizant of the fact that we try to do a lot when they do come in, because it's not as easy as like, again, follow up in 2 weeks. Sometimes we have to adjust schedules, adjust what we're doing to maximize that time that they're here in town with us.
Sometimes that time might mean looking at their own schedules.
And this is kind of life that not everyone who lives in more centralized hubs appreciates, that how much effort even something as basic as going to work can sometimes be.
Remember earlier when we were talking about the weather? Since it's kind of a thing in the upper Midwest, it's important here too. For Dr. Brown and her colleagues and clinic team in Dickinson and communities like this across Sanford Health's vast footprint, Dr. Hoffman's words could echo across the windy plains.
There's a lot of teamwork. I think there's a lot of flexibility too, knowing that unexpected things come up. Like again, when she was driving in to work, I don't know if she told you the story, but she definitely hit a deer on her way in here, and so her day changed a little bit. Again, part of living far away from the location you're working out in rural western North Dakota, eastern Montana. So just we all have to be supportive, flexible, and able again just to adjust again with what the day brings.
As the team in the Dickinson Clinic stands together for each new day, they're the front door to the people that are needing health care in western North Dakota.
That those individuals are the way that our patients are going to engage with us as a health system, but also how they're going to feel safe and how they're going to trust us to provide that care. So it's really, really important that we listen to and we understand what those frontline workers, clinicians, nursing staff, patient access staff, we have to understand what they need and what challenges they're having on a day-to-day basis, and then try to help and put the resources in place for them to do their job the best they can.
One of the things that Sanford Health and Dr. Crabtree pay attention to is balance. There's work and there's family. They do come together in a way.
For most of us in healthcare, we spend as much time and sometimes more time with our work families than we do with our families at home. And so if we're providing and or able to work in an environment where we're feeling supported and we're feeling connected to our employer and our staff, I think what that's going to do then is it'll translate into feeling better about going home. We can leave work at work and we can go home and do what we need to do at home. Also understanding that the organization values that family connection. I mean, we use this terminology. I use this terminology on a regular basis. I call it being part of our Sanford family when I'm talking to new recruits that are coming to the organization or contemplating coming to the organization. I talk about how we want them to be part of the Sanford family, and that's our work family, but our work families get connected to our at-home families. And I would say that may be amplified in our small or smaller communities because of the connections that I mentioned earlier. It's not just about going to work and leaving it at work. Your coworkers are probably your friends that you go to a football game on Friday night with, or maybe you're on a bowling league or a card club or something. Our teams are connected in many different ways. So I do think that ability to feel supported in the organization at work translate to feeling supported at home.
Here at Sanford Health, I value, giving patients good quality care, being able to provide a service where, they would otherwise have to go to another community. I think that's something that Sanford seeks to give care in rural areas. They've expanded into rural areas because they see a need bringing health care to patients versus patients having to travel for health care.
Bringing health care to patients. It's not by accident. People like Dr. Crabtree and other physicians and clinicians are leading the way.
Our clinician governance structure, our clinician leadership structure, it's all put in place very intentionally to make sure that we have physician and clinician input into decisions that are made about how we move our organization forward.
This matters and helps in growing the team, but also when it comes to recruiting new people to the organization too, like Dr. Elizabeth Brown, Ob-Gyn, in Dickinson, North Dakota.
For our clinicians to be able to see that we have a leadership structure, we have leadership development opportunities for those clinicians that want to progress. Just by definition, a clinician in the role that they play in our healthcare system, they are leaders of teams, the healthcare teams. But if they want to expand that leadership education or opportunities, we have resources, we have internal leadership development programs that will help our clinicians attain those goals, and we're actively seeking those individuals to make sure that we're providing that for them, or they're able to find it if they want it. I think that's an important piece as to how we develop our own and grow our own. I would also say that Sanford's investment in graduate medical education and in our own training programs, that's significant. We know that depending on who you read, 40 to 50% of trainees, so we're talking residents and fellows, will stay within 100 miles of where they train. So by investing in those training programs, we know that we're going to have a pipeline and a pool of excellent physicians for years to come. I think that also speaks volumes to how the intentionality of the structure is to make sure that we will have those clinicians who can work in those rural areas.
This investment into people and growing physicians is important, even for new people joining, like Dr. Brown.
I think having physicians in those leadership positions and not just administrators that have never practiced, I think it's useful that they have been on the other end of things. No matter who I reach out to, they're very supportive, and they want me to succeed as a physician as well as a person. Physician leadership is always checking in, making sure that there's, if there's any problems or issues, especially they know, my living situation. They're always just checking in and making sure that, asking about how are the kids, how's the husband, how are things going. That was just something that just never really experienced in my last job. And that's kind of why I chose Sanford.
Sanford Health is the largest rural healthcare system in the U.S. So how do you do that? Dr. Brown has shared her story and why she does what she does. Dr. Hoffland has lived in Dickinson for a long time and shared some of her thoughts. And Dr. Crabtree, well, his part feels almost like watching over a closely guarded family recipe on just how Sanford Health is focusing on people. But really, it's not that much of a secret. And Dr. Crabtree and the family have just been doing it for quite a while.
We've been very intentional about trying to, if distance is a barrier, if resources are a barrier, if finances are a barrier, if transportation's a barrier, if weather's a barrier, we're trying to put the resources in place to make sure that our patients have access to the care they need. Because we know that if we don't reduce those barriers, people will just not access health care. We want people to live in the places they want to live. We want them to be able to access the care they need to have access to. And in order to do that, we have to put processes in place and strategies in place. And that is our virtual care. It is our ability to recruit and retain clinicians within those facilities. It's to partner with communities that our healthcare facilities are in as to how can we make sure that there are good schools, daycare providers, things that help a community be strong and vibrant. We want to work with those communities too as a healthcare provider within those communities, because we know if the community is strong and the healthcare is strong, then the people are going to get the care that they need.
It's very rewarding to work with rural patients. They respect our opinions. They are excited that we're here. They like the fact that they can get good quality care in rural areas. The other thing is just family-wise, the communities of these smaller communities. You have a lot of opportunities for children. It's a safer communities. You get to form those relationships inside and outside of the clinic and just be able to really, care for people in a closer knit type of situation. And you get to, the continuity over years of being in the community. Eventually, hopefully I'll be delivering some of the people I delivered.
Healthcare is about people. People helping people no matter where they live. Elizabeth Brown is a physician, and a darn good one. Her Sanford story is a fairly new one. And next time when she walks into the clinic to see her patients, remember, Dr. Brown has a story just like you. Now, Dr. Brown's story maybe includes a few hundred more bales of Montana hay than yours or mine, and when she's not in the clinic, you're likely to find her on that ranch where she's busy doing all sorts of things, just like a lot of the people she's going to see tomorrow. And oh, by the way, if you have any leads, Dr. Brown is still looking for that one thing.
When I decided what I wanted in life, I always wanted to have at least a few animals. So I still have not got my horse, but that will come. So